What is frozen shoulder? In simple words, frozen shoulder is a condition in which joint of the shoulder, it starts getting restricted. So because of the capsule which lies over this joint, this is basically a ball and socket joint in the shoulder, which is covered by a capsule. So that capsule starts shrinking, and the reason for this is mostly not known, but it is seen more commonly in case of females, especially after the age of 40, and in those who are diabetic. So if you are having complaints like restriction of shoulder movement, especially in the movements where you have to pick up something from the top shelf, or you have to bend your hand backwards like this, these two movements, they get restricted to the maximum extent. So normally patients present with pain over the shoulder, but majority of the pain is near the outer part of the shoulder. So when this pain is there, it is more severe in the night and followed by a restriction of movement. So if you are having symptoms like shoulder pains more in the outer part of the shoulder, pain more in the night, and restriction of movement, and especially two movements like taking your hand up and taking your hand back, so you might be suffering from frozen shoulder. Now, frozen shoulder treatment depends on what type of or how much the severity of the pain is and at what stage it is. Normally there are 3 stages of frozen shoulder. In stage 1 there is pain, but restriction of movement is minimum. In second there is pain restriction as well as pain persistence as well as the movement restriction. And in third stage the movement and the pain, the movement starts increasing and the pain starts reducing, but it can take up to 3 to 6 months. So if you don't want to suffer for that long, it is best you see your doctor, who will examine you clinically, and maybe he'll get an MRI done to confirm the diagnosis. This is also known as adhesive capsulitis. So if your MRI is suggestive of adhesive capsulitis, it is the same thing. So now the treatment normally is through physiotherapy. You should go to a physiotherapist for 3 to 6 weeks, who will start you on exercises as well as range of movement exercises, so that this movement normally comes back to normal. Also, the doctor will give you some pain medicines or anti-inflammatory intermittently, so that your pain is kept under control. Almost 99% of the patients can be treated by just physiotherapy and occasional medicines. In rare situations when pain is too much or patient is not able to do physiotherapy, we might give shoulder injection also. And in extreme rare condition, when nothing seems to be working, then only surgery is required. And if surgery is required, it is done through arthroscopy, in which we release the shoulder capsule. We open it up so that the movement of the shoulder comes back to normal. So if you are suffering from frozen shoulder, don't worry. See your doctor, and most likely it can be very well treated with just exercises and medicines. Thank you.